Welcome to London Today. I'm your host, Missy Haggerty. I'm with Dr. Maria and Amanda from Synergy Center and Beauty Within. Thank you for being here, ladies.
Thank you so much for having us.
So I really wanted to talk about this topic because there seems to be a lot of mystery and also just people wondering how it all works and things, which is medical aesthetics. So I want to talk a little bit about your clinic, and one of my first questions is how do you find a good clinic and what sets you apart?
Well, absolutely. I mean, the first place to start is doing your research. So take a good look, see what you're getting into, see who is the injectors at the clinic. So a good place to start is Google reviews. You can start taking a look at the website for the clinic as well. Oftentimes on websites, they'll have biographies or little snippets about the providers.
Okay.
I do recommend taking the time to read those so that you know who is operating the clinic. Are they doctors? Are they nurses? Are they regulated professionals? Because these are medical procedures at the end of the day, and just taking a look to get to know them a little bit better. What did they go to school for? What kind of education do they have? And a lot of times it should include, what types of training they've had, medical aesthetics specifically. So you can get a bit of a hint about who the person is before you walk into the clinic, and maybe start building that trust even before you step into the clinic.
I think you touched on it, but I don't think people realize it's medical.
Absolutely.
And so you really have to look at your provider well.
Absolutely. It's aesthetic and it's optional. It's not, a medical need, but it's still a medical procedure.
What sets you apart, Dr. Maria?
I would like to say that we strive for excellence. This is what drives us. This is what sets us apart. Excellence in obtaining good cosmetic results for our patients, excellence in continuing to improve ourselves, to learn, to improve the technique, and excellence to make sure that everyone is treated well, has a good experience in the clinic, and we form a long-term relationship with our patients.
I think you probably also do a really great job with your staff and your team, because everyone that I've interacted with, you're all very connected and you all very mesh well together. And I think that's really important when people are looking for a place to get this done, because it's a very personal thing and it's a very personal experience, I think.
Absolutely.
Yes.
So I would say, hopefully, and we feel that we provide this, is that, from your first step in the door, or even before you get in the door, even just on the phone, that your experience starts off on the right foot, and every step along the way you're taken care of. So whether it's from the front desk staff to interacting with myself as the nurse, and every patient meets Dr. Maria here as well. So hopefully the experience is, kind, trustworthy. At the end of the day, we do strive to provide good results as well, but it's the experience as well. So we want you overall to feel taken care of and heard.
Well, and you need, especially first time doing anything like that, you need a little bit of hand holding, I think. And it's just nice that the process is very seamless.
Absolutely. We strive for that.
So tell me the difference. And this is the big thing that I think a lot of people don't understand, which is the difference between Botox and the difference between filler.
I will answer this.
Absolutely.
The Botox is a neuromodulator that relaxes the muscle that actually pulls the skin when it contracts.
Okay.
So if the muscle underneath the skin is relaxed, the skin is not wrinkled. So that's Botox, or the neuromodulator. The filler is a soft gel, mostly composed of hyaluronic acid. There are other type of fillers out there, but the hyaluronic acid is the most used.
Okay.
The hyaluronic acid is a component, it's a sugar that is naturally occurring in our skin.
Okay.
And we inject that in different layers of the skin, or the fat underneath the skin, or on top of the bone, to lift the skin, to replenish the volume that is lost with aging.
So as you age, you lose that volume then?
Absolutely. Unfortunately, aging affects many different layers.
Yeah.
So we're looking at, changes down to the bone level, changes in our muscles. Sometimes they get a little bit stretched out or thinner. They're not as strong anymore, or some become overactive even. Differences in the fat layers and the way things like to kind of shift. They like to come down and kind of come towards the center of the face, giving us a heavy look. So ideally, these treatments are to refresh, not give a totally different look, it's still you, but really rejuvenate those tissues where the changes have taken place.
So what I'm getting from you both is you should make sure that whatever place you choose, you get a very good consult beforehand, and that there should be a doctor present for the consult, or at least some part of the process.
For sure, keep in mind it's a medical procedure, so definitely we need to obtain medical history. We need to understand everyone's medical profile, medication that they take, allergies, and of course we need to understand their aesthetic goals. There are many models out there, models that work with doctors alone, models like our clinic that is a doctor-nurse model, or models that work with nurses alone. So just make sure that you are in good hands. Sometimes I see in our patients they go to 2 to 3 clinics before they make a decision. If that's the case, analyze who did take time to spend with you, assessing your needs, communicating well with you, educating you about the aging, about what is going on with your face, and then choose wisely. It's a medical profession, it's a medical act, and it needs to be treated seriously.
How do you decide, I always see people advertise by unit. How do you decide sort of how many units, and that you're not putting in too many units, I guess is what I'm trying to say, that you're just going in with exactly what they need for units?
So typically it all starts with a good consultation and a good assessment. And so that's why all of our first-time patients they meet with both myself and Dr. Tetelbaum, or one of the doctors on staff, so that we can take a good assessment. And that usually involves taking a look at the face at rest, but also in animation as well, because dosage or amount of a product is unique to everyone.
Okay.
So, you or I might need a different dose or a number of units of Botox to get us a certain result that we're looking for. Oftentimes we take into account, well, I shouldn't say oftentimes, we always take into account the strength of your muscles, the size of the muscles, the amount of activity that you use on a daily basis for them, because if you're always making one same expression, you're always frowning or squinting at the computer screen, you're going to start notice a furrow appearing between the eyebrows. And we take a look at how you use your muscles when it comes to Botox to help us determine that dose. Men do take a little bit of a larger dose than females, so there is definitely a difference in between the sizes and strength of muscles in between the males and females, so we also take that into account as well.
What kind of maintenance should people be doing in between treatments? I would expect your ideal person is somebody who naturally likes to take care of their own skin while in between.
So with Botox treatments, we usually recommend a treatment every 3 to 4 months. And with filler, once we completed the treatment, so we reversed most of the activated aging trigger points, then we'll do once a year maintenance for the filler, much less in volume than the original treatment. Okay. Even the original treatment, sometimes we need volume, especially in people that lost a lot, or people that have facial deficiency, like we have even younger people that present with bone deficiency, small retruded chin, or small cheekbones, right? Narrow cheekbones. So those people will need volume. And sometimes that treatment is split in several sessions. After we complete all the sessions, then maintenance once a year with filler is recommended.
And when should people start down this road? Like some people, I think that they start when they see the lines and the wrinkles happening, but maybe it might be better to start sooner than that to make it more effective?
Well, of course, you know, we don't get too hung up on the age specifically, because some of us do start to age or show signs of aging before our peers that are the same age. Sometimes we just have structural differences, or, you know, things that have been inherited genetically, so we're predisposed to aging in certain areas. We like to call them aging trigger points. They, you know, they start to age before your actual biological age and can make you look older than you are. It is good to get ahead of those ones and start to address them earlier on. But of course, there's not a specific age we would say that you start at. We do see, you know, late 20s and 30-year-olds, absolutely, but those are more so addressing the aging trigger points.
So out of curiosity, if someone starts in their late 20s, is it by the time they're in their 40s and their 50s, is it become less effective because they've been doing it for a long period of time, or does it just stay as like maintenance and they still see the effects of it?
Yeah, the opposite. When people start early, sometimes we prevent the deep permanent lines forming. Initially, they might have just wrinkles in certain expressions and just very fine lines. With age, progressing in life and repeating those expressions, then they will form permanent lines. So repeating Botox treatment will prevent those deep lines for forming. Same as we said, people with people with structural deficiencies, when you build up their cheeks or their chin, you stimulate the skin to produce collagen, so the filler will get integrated in their tissue and they'll form their own tissue to correct their deficiencies. So this will just improve over time. So there is a myth that we get immune to Botox or
That's
to the
word I was looking for.
to the neuromodulators. No, there is a word that we say myomodulation. The muscles do adjust their function upon treatment, and we see a big improvement in the overall face expression.
Is it good to do sort of a combination of Botox and filler? Is that?
Yes, absolutely. So combination treatment is ideal, you know, but of course we're not going to recommend a treatment that's not applicable. It just so happens that a combination of neuromodulator treatments and filler treatments happen to give an overall good look. Then we can address some of the wrinkles and lines that are caused by expressions with the neuromodulator, and address the volume loss, descent, and repositioning of tissues with the fillers.
Okay. Well, thank you for being here, Dr. Maria and Amanda. It was a pleasure having you. And thank you for educating us so well on this topic. It's kind of a scary topic.
Thank you for us, for sure. Now with people living longer, everyone wants to look their best. So I think the medical aesthetic is growing rapidly. So we'll need more education. We'll need to talk about that. Before it was taboo. Nobody wanted to share their story. I think more and more people come out because we see the good effects of it.
Well, thank you for being here.
Thank you.
Thank you so much for having us.